name is Grace Berardini. I'm a PA student at James Madison University. How are you doing today?
Good.
Mr. Teason?
I'm doing well.
Good. Glad to hear it. What brings you in today?
I've had this earache for about a week.
An earache?
Mm-hmm.
Okay. So can you point to exactly where it's located?
It's more inside.
More inside?
Yeah.
Does it hurt at all on the outside?
No, not really.
Does the pain radiate anywhere?
Yeah, no, it's kind of just
Kind of in the inside. Okay. And when you said this started about a week ago?
Yeah.
Okay. And what kind of a pain are you experiencing? Is it stabbing, burning, achy, more of an irritation?
Mm-hmm. Yeah, it started as kind of an ache, and now it's getting worse, and it kind of feels like sharp.
A sharper pain?
Yeah.
Okay. And if you were to rate that pain on a scale from 1 to 10, what would you give it?
A 7.
A 7?
Mm-hmm.
Okay. What have you tried anything to make it feel better?
No.
No? Okay. Does anything make it feel worse?
No.
No? Okay. Does it hurt worse at any certain time of the day?
No.
Not really? You haven't noticed it more hurting in the middle of the night or in the morning or anything?
No, it's pretty constant.
It's a constant pain. Okay. And what kind of an effect has this had on your life?
I've been able to do pretty much everything. It's starting to hurt pretty bad.
Yeah, okay.
Mm-hmm.
And have you had any other symptoms associated with this?
No.
Okay. So what I understand I can review for you is that you came in for ear pain. It started about a week ago.
Mm-hmm.
It started out not too bad, but the pain got to about a 7 out of 10, more of a sharp pain.
Mm-hmm.
And it's not really impeding on your life, but it's starting to hurt quite a bit, and you sought attention for that today. Is that right?
Mm-hmm.
Okay. Do you have any idea what this might be?
I was thinking maybe an ear infection.
Maybe an ear infection. Do you know anyone else with these types of symptoms?
No.
Okay. All right. Well, since you're a new patient, I'm going to go ahead and get kind of a full history on you today, if that's okay. I'm going to start with just how you think your general state of health is.
Pretty good. Yeah.
Do you have any allergies?
I don't.
To foods?
No.
Medications?
No.
Okay. Are you on any medications?
No, currently no.
Okay. Did you have any childhood illnesses?
Chickenpox.
Chickenpox, what age?
When I was 4.
Okay. Have you ever been hospitalized as an adult?
No.
Have you ever had any surgeries?
Mm-hmm.
Have you ever sought psychiatric counseling?
Mm-hmm.
Do you see a practitioner regularly for yearly exams?
Mm-hmm.
No? Okay. Something to keep track of, just making sure you're on top of your health. But, okay. Have you ever had any accidents or injuries?
Minor sprains.
Okay. What age? What kind of a sprain?
A couple years ago, I sprained my ankle.
Okay. Has it gotten better?
Yeah.
Okay. Have you ever had a blood transfusion?
No.
Are you up to date on your immunizations?
As far as I know, yes.
Okay. Have you gotten your flu shot this year?
Mm-hmm.
Great. Okay. Well, now I'm just going to move into your family history. Are your parents alive?
Uh-huh.
And how old are they?
My dad is 62. My mom is 60.
And do they have any health problems?
None that I know of.
Okay. And do you have any siblings?
I have a brother and a sister.
And how old are they?
My brother's 27. My sister is 25.
Do they have any health issues?
No.
Okay. How about your mom's parents, your maternal grandparents? Are they living?
My grandma is.
Okay. How old is she?
I'm not sure. 90.
Wow. Okay.
Yeah.
Does she have any health issues?
I think so, but I don't know what they are.
Okay. And did your grandfather pass away?
Uh-huh.
At what age?
90.
And do you know what it was from?
No.
Okay. How about your paternal grandparents? Are they living?
They are not.
Okay. And what age did they pass?
I'm not sure.
Okay. Sorry for your loss. Okay. Well, now I'm just going to get a little bit more information about you as a person. So, what do you do for a living?
I'm a student.
You're a student? What are you studying?
I'm studying physician assistant to become a physician assistant.
Wow, very cool. Are you managing stress well, or are you having a hard time?
Yeah, I think so.
Okay.
Mm-hmm.
What do you do to work with your stress? Make it better.
With stress, exercise.
Okay. Great. And can you describe a typical day for me?
Yep. Get up, have breakfast, go to class all day, and then study in the evenings.
Okay. Great. So, do you have any spiritual or cultural concerns that would affect your health care?
No, none that I can think of.
Okay. Great. Well, then I'm gonna move into just kind of a little bit about your personal habits. Do you use alcohol?
Uh-huh.
About how frequently?
A couple times a week.
Okay. And on any given occasion, how many drinks do you have?
2.
Okay. Have you ever used tobacco products?
No.
Have you ever used illicit drugs?
No.
Tell me about your exercise habits.
Exercise sporadically, but at least once a week.
Okay. And can you tell me about your diet?
I eat regular food.
Okay.
Try and eat 3 meals a day.
Great. And have you traveled outside the United States recently?
I've not.
Okay. Are you exposed to any environmental hazards like smoke in your school, home, or work environment?
No.
No? How about, do you wear your seatbelt every time you're in the car?
I do.
Do you have smoke detectors in your house?
Yes.
Okay. And can you tell me a little bit about your sleep habits?
I mostly get between 6 to 7 or 8 hours a night.
Okay. Great. That sounds really good. Well, now I'm going to move on to just some questions about your sexual history. These questions can be kind of personal, but just let me know if you don't feel comfortable answering any of these, and that's totally fine. Is it okay if I start?
Mm-hmm.
Okay. Are you sexually active?
Mm-hmm.
Do you have sex with men, women, or both?
Women.
Okay. Do you have a current partner?
Yes.
Okay. How many partners have you had previously?
1.
Okay. Do you have vaginal, anal, or oral sex?
Vaginal.
Okay. Have you ever had an STD?
No.
Are you or your partner at risk, or any of your previous partners at risk for HIV?
Not that I know of.
Okay. Do you have any concerns about sexual function?
Mm-hmm.
Do you feel safe in your relationship?
Mm-hmm.
All right. Now I'm just going to kind of move into a review of all of your body systems, just to get some more information, try and see if we can figure out what's going on with the earache.
Okay.
Have you noticed any weight fluctuations recently?
No.
You changed in appetite?
No.
Any weakness or fatigue?
Mm-hmm.
Have you noticed any changes in the texture of your hair, skin, or nails?
Mm-hmm.
Notice any rashes on your skin?
Mm-hmm.
Any itchiness of your skin?
Mm-hmm.
Okay. Do you experience frequent headaches?
No.
What, dizziness?
Mm-hmm.
Have you ever lost consciousness?
Mm-hmm.
Do you wear contacts or glasses?
Mm-hmm.
Do you ever have any blurred vision?
No.
Any itchiness of your eyes?
Mm-hmm.
I know you said you've been having this dull earache. Has this happened before?
When I was little.
When you were little, but not since then. Have you ever had any discharge from your ear?
Mm-hmm.
No. Do you feel like you could hear equally out of both ears?
No. Or yes.
Okay. How about, how's your sense of smell?
Good.
Have you ever had frequent stuffy noses?
Mm-hmm.
Okay. How about any discharge from your nose?
Mm-hmm.
Do you have frequent sore throats?
No.
How about, have you ever had any sores on your tongue?
No.
Any cavities?
Mm-hmm.
Okay. Have you ever felt any lumps or discomfort in your neck?
Mm-hmm.
Have you ever had any stiffness in your neck?
No.
Any pain? Okay. Have you ever felt a lump in your breast area?
Mm-hmm.
Have you ever had any pain or discomfort in your breast area? Got any discharge from your nipples? Have you ever had problems catching your breath?
No.
About a persistent cough?
Uh-uh.
Okay. Any tightness in your chest?
Mm-hmm.
Have you ever felt like your heart skipped a beat? How about that you have extra beats in your heart rate?
Mm-hmm.
And no pain? Okay. Have you had any changes in your bowel movements?
Mm-hmm.
Any pain in your abdomen? Any nausea or vomiting? Okay. How frequently do you urinate? Okay. Do you have any pain with urination?
No.
Any problems with stream flow?
Uh-uh.
Okay. Do you give yourself regular testicular exams?
Mm-hmm.
Have you ever felt a lump?
Mm-mm.
Okay. Do you have any sores on your penis or testicles?
No.
Have had any discharge?
Uh-uh.
Okay. Have you ever noticed any frequent leg cramps?
Mm-mm.
Had any distended veins in your legs?
No.
Any tingling in your toes or fingers?
No.
Do you get backaches?
No.
Any pain in your joints?
No.
Any like stiffness in your body, your muscles, or anything?
No.
Do you bruise easily?
No.
Do you bleed easily?
No.
Do you ever get any nosebleeds?
Mm-mm.
Have you ever noticed a change in your shoe or glove size?
No.
Do you have excessive sweating
No.
or excessive hunger or thirst?
No.
And do you ever experience frequent nervousness?
No.
Any changes in your mood, fluctuations? How about, do you experience anxiety ever?
Uh-uh.
All right, Matt. Well, it was really nice to meet you. I'm going to go back and speak with the physician, and we're going to try and figure out what's going on with your earache, okay?
Okay.
All right, thanks very much.
Thank you.